This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Hello, I'm Dr. Judson Brandeis. Today, I want to take a deeper, more comprehensive look at erectile dysfunction and the landscape of treatments available. I find that when men come to my office, there's often a lot of confusion and misinformation. My goal is to clear that up and give you a full picture of the modern, personalized approach we take to restoring sexual health. First, let's establish the scope of this issue. Erectile dysfunction is an incredibly common medical condition, affecting the sexual lives of millions of men worldwide, most often between the ages of 40 and 70. It's not just a minor inconvenience. It can have a major impact on quality of life, leading to depression, anxiety, and a loss of self-esteem for both men and their partners. And as our population ages, the number of men affected is expected to grow significantly. In the late 1990s, it was estimated that 152 million men were affected worldwide, with projections that this number could reach 322 million by 2025. It's crucial to understand that normal sexual function is a complex biopsychosocial process. It relies on a perfect coordination of psychological, hormonal, vascular, and neurologic factors. I often tell my patients to think of ED as a check engine light. It's a signal that one of these systems might be out of sync. It can be caused by physical conditions like vascular disease, diabetes, or hypertension, or by lifestyle factors like smoking and alcohol use. Now, for many years, the primary solution offered has been a class of drugs called PDE5 inhibitors, which include well-known brands like Viagra and Cialis. These are considered a first-line therapy and have been a fantastic tool. However, they are not a perfect solution for everyone. It's estimated that between a quarter and a third of men with ED either don't respond to these pills, become less satisfied with them over time, or have to stop due to side effects. The most critical issue is the absolute contraindication for men who are taking nitrate medications for heart conditions. The combination can cause a precipitous and dangerous drop in blood pressure. This has left a significant group of men feeling they have no safe oral treatment options. This is where understanding the full range of treatments becomes essential. If the first-line oral pills don't work, we have other options. This includes second-line therapies like intracavernous injections and third-line therapies like the surgical implantation of a penile prosthesis. But there is also another different kind of oral medication that works on a completely different principle. This medication is called apomorphine. Instead of working directly on the blood vessels in the penis like PDE5 inhibitors do, apomorphine is a centrally acting dopamine agonist. This means it works on the command center, your brain. Specifically, it stimulates dopamine D2-like receptors in a part of the brain called the paraventricular nucleus of the hypothalamus. This action helps to amplify the brain's natural proerectile signals that initiate the entire process. It also has a lesser, secondary effect on dopamine D1-like receptors in the penis itself. Think of it this way. If PDE5 inhibitors help the speakers play the music louder, apomorphine helps the radio station broadcast a stronger, clearer signal from the start. For this signal to be effective, the brain requires nitric oxide as a cofactor to activate the neuron's apomorphine targets. It's delivered as a small tablet that dissolves under your tongue and is typically taken about 20 minutes before sexual activity. So, what does the evidence say about how well it works? We have excellent data from a systematic review that analyzed 9 randomized controlled trials. The main outcome researchers looked at was the percent of successful sexual intercourse attempts. In 8 of the 9 studies, apomorphine was found to be better than a placebo, leading to between 6% and 27% more successful attempts. When looking at erectile function scores on questionnaires like the International Index of Erectile Function, IIEF, 3 studies reported a higher improvement for apomorphine. But good medicine is about nuance. The effectiveness can vary depending on the patient. For example, in 2 studies, the improvement in erectile function scores was not considered clinically relevant, which is defined as a change of at least 4 points on the IIEF scale. One of these studies exclusively involved patients with diabetes, and the other involved men who had undergone a radical prostatectomy or the surgical removal of the prostate. The finding in the prostatectomy patients is particularly important. This surgery can damage the nerves that carry the erection signal from the brain to the penis. The evidence suggests that if that nerve pathway is broken, amplifying the signal at the source with apomorphine won't be effective. This brings us to safety and dosing. The most common side effects associated with apomorphine are nausea and vomiting, followed by dizziness and headache. These adverse events are strongly linked to the dose. Early studies tested doses up to 6 milligrams, but it became clear that higher doses led to more side effects. As a result, the recommended strategy is to start with a 2 milligram dose, which can be increased to 3 milligrams if necessary, with a minimum of 8 hours between doses. At these lower doses of 2 or 3 milligrams, apomorphine is generally well tolerated. And to address the core problem we started with, the studies confirm that apomorphine is the only licensed oral ED drug that is not absolutely contraindicated for use with nitrates. So, what does this all mean for you? It means that modern urology has a deep toolbox, and we've moved far beyond a one-size-fits-all approach. A thorough consultation is the most important first step. We need to have a detailed conversation about your complete medical history. Have you had prostate surgery? Are you on nitrates? Do you have diabetes? We can run simple blood tests and sometimes imaging to get a full picture. Only then can we create a truly personalized plan. For one man, a PDE5 inhibitor might be the perfect fit. For a man with a heart condition on nitrates, apomorphine may be the ideal oral option. For a man who has had a prostatectomy, neither of these oral agents may be effective, and we would then discuss other highly effective options like injections or a penile implant. My ultimate goal is to help you regain an essential part of your life and your well-being. Restoring function is about restoring confidence, intimacy, and vitality. The most critical message is that you are not broken and you don't have to settle. ED is a treatable medical condition, and by working together, we can navigate the options and find the specific solution that is safe, effective, and right for you. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.